Good day, I am Ma'am Pamela Araulio and I will be discussing the Introduction to Rehabilitation Sciences. So before we focus on each courses offered in the College of Rehabilitation Sciences, let's focus on defining what is Rehabilitation Sciences all about. So here are the learning outcomes for today's topic. At the end of this lecture, you will be able to define the field of rehabilitation sciences, explain the basic terminologies related to rehabilitation sciences, and identify the members of the rehabilitation team. So let's look at the definition of rehabilitation sciences. According to the University of Washington, it is a field of study, and it compasses the basic and applied aspects of health sciences, social sciences, and also engineering to restore functional capacities of a person and to improve their interactions with their environment. As a profession under the rehabilitation sciences, we relate to the function of the human body in health, disease, and disability in their current environment. A professional with broad expertise in this arena is the basis in excelling in a number of health-related fields. So since this is an interdisciplinary field of health sciences, social sciences, engineering, and others, we need coordination from each of these professions. So, in our college, rehabilitation science careers includes a variety of interdisciplinary fields focused on improving the lives of people living with disabilities. People who work in rehab sciences such as OT or occupational therapist, physical therapist, and speech and language pathologist help individuals become independent and self-sufficient. So, as a profession, we direct to enhance and restore functional capacities of the individual and also their quality of life. Many professionals who also work in the field become researchers and develop rehabilitative treatments and technology that are timely and also evidence-based. A graduate from an accredited institution such as HSI as well as certification and licensing is required for a career in this field. So let's define rehabilitation and habilitation. So here are the keywords that we have to look into: enhance and restore. So when we say rehabilitation or rehabilitative services refers to healthcare services that help keep a person restore or improve the skills and functioning that has been lost or impaired because a person was sick, injured, or disabled. When we say habilitation or habilitative services, this refers to healthcare services that help a person acquire or keep or improve partially or fully at different points in life skills related to communication and activities of daily living. So this includes therapy for a child or a person who isn't walking or talking at their expected age, and they are expected to acquire the knowledge and skills that they need to learn so that they can keep up with their developmental or expected age. So now let's identify whether these goals are rehabilitation or habilitation. So again, when we say rehabilitation, this is when we restore lost function. And when we say habilitation, this is acquiring skills that are not yet there. So let's identify these goals. To restore lost functioning, this is rehab or rehabilitation. When we teach a new skill to a patient, this is habilitation. To acquire new developmental or normal developmental milestones for a kid, this is habilitation. And to improve an impaired skill, so we want to restore an impaired skill, this is rehabilitation. So I hope you get that perfectly. Now let's look at the table wherein we tried to differentiate more what is rehabilitation and habilitation. As you can see, rehabilitation is focusing on the old skills or learning the old skills that have been lost or impaired, and the person cannot do the daily functioning skills that they want to do because of these lost or impaired skills. So we want to restore so that a person can maintain and improve these skills. When we say habilitation, this is acquiring new skills or learning new skills that are not yet attained by a person for daily functioning of daily living skills. So if these are not yet attained, then we try to acquire it and maintain and improve these skills as we go along. Now let's look at some basic terminologies. The words impairment, disability, and handicap are often used interchangeably. However, they have very different meanings. The most commonly cited definitions are those provided by the WHO in the International Classification of Impairments, Disabilities, and Handicaps. Now, let's look at them one at a time. First, we have impairment. Impairment is an alteration or deviation from normal in your anatomical, physiological, or psychological structures or functions. Some of the common examples are pain, swelling, limitation of motion, or at times weakness. So for this example in particular, so if you fracture your arm or if a person fractured his or her arm, normally our upper extremities are used to do chores around the house and your school. So if we fracture it, we experience pain in the affected arm. So the arm may be swollen and the movements we do will be limited because of it. So these are the impairments that alter the normal function of the arm and is a consequence of having a fracture. So impairments as a sequelae is, if you experience pain as an impairment, this may cause other impairments such as limitation of movement or motion around the extremity because patients are afraid to move the arm because it will worsen the pain. When you say functional limitation, these are the inabilities of a person to perform an action or activity at the level of the whole person in the way it is done by most people. So this is usually a result of an impairment. So for example, if a person has a fractured lower extremity bone, this person will have difficulty in walking or unable to get out of the bed. So these are some of the examples in terms of physical functioning, wherein a person has difficulty in getting out of bed, walking, climbing because of their diagnosis and because of their impairments. But sometimes, or most of the time, rehabilitation sciences do not just focus on those functional limitations. We also focus on psychological functioning limitations. So what are these? If a person has an impairment in self-esteem or has low self-esteem, body image, experiences anxiety and depression. So these are some of their impairments. And they will have difficulty in their psychological functioning as a person. We still look at, or we also look at the social functioning of a person. Meaning, if a person cannot perform their societal roles like visiting relatives and friends, or their role as a student because of their impairments, such as, for this example, a kid who has a visual impairment will have difficulty in performing her role as a student. Next is disability. So when you say disability, this is the limitation or inability to perform action, tasks, and activities that are usually expected in specific social roles. So what are your roles? So some of your roles are, you are a daughter, a son, you are a student in high school. But some of the roles of other people are their roles as a parent, as a teacher, as a homemaker. So if a person cannot do it or cannot perform their expected roles because of their impairments or functional limitations, then this is called a disability. So, thus, if the individual is unable to assume societal roles such as working or being a parent or a student going to school, attending church or other group activities, participating in sports or recreation and other recreational activities, then we are dealing with disability. So next is handicap. Handicap is social disadvantage of disability as a function of a society's response to needs of people with different abilities. So this is what we call a social stigma or barriers of a patient or a client with disability. So as rehabilitation professionals, a PT, OT, and SLP can help change discriminatory social attitudes and environmental restrictions such as architectural barriers that stigmatize individuals and restrict participation in all aspects of society. So since we are knowledgeable about the needs of a person with disabilities, we can work closely with other professionals to help them remove the social stigma and barriers not only in the environment but also in their everyday functioning. Let's look at the rehabilitation team. So let's identify the members of the rehabilitation team and their functions. First, we have our client. So the client is the most important member of the team. The client usually has the disorder or the diagnosis that requires interventions to improve his or her function. They usually consult with the doctors. And with the doctors, you have our nurses, or we have our nurses in the hospitals. We also have our respiratory therapists. So they work with patients of all ages, from premature infants with underdeveloped lungs to senior citizens with advanced chronic obstructive pulmonary diseases, or COPD. Next, we have your prosthetist or orthotist. So the orthotist makes braces and splints used to strengthen or stabilize the part of the body. So prosthetist makes and fits artificial body parts such as an artificial leg or arm. Now we have here your vocational counselors. Your vocational counselors usually are the persons who we talk to for the impact of illness or injury with adaptations to return to your vocational roles. We also have social workers. So they are identified as supportive services needed after discharge. And chaplains. Usually chaplains are for support or for our support in spiritual and religious practices. We also have psychologists. So overall, psychologists assess, diagnose, and treat persons with psychological problems and the behavioral dysfunctions resulting from related to physical and mental health. We also work with dietitians. Most dietitians work in the treatment and prevention of diseases in administering medical nutrition therapy as part of the medical team. We also have recreation therapists. So this is a therapist who coordinates therapeutic recreation programs to help promote social skills and leisure activities. Case managers are rehabilitation case managers that helps plan, organize, and coordinate services and resources for the client. So, since the client is part of the rehabilitation team, speech therapist, sports therapist, your occupational therapist, and physiotherapist or PTs also work with the client. Usually, in the Philippine setting, the physiatrist strongly dominates the practice of rehabilitation. So, other members of the team are given specific orders by the physiatrist or from the rehab doctor. They give out the orders for the client. And usually, they are tagged as the team leader. So, they are responsible for coordinating the patient care services with other team members. So, a 3-year residency training is needed to specialize in physical medicine and rehabilitation. So, in other countries, team members are encouraged to make a separate goal and program, which are then presented in a team meeting, and the physiatrist helps facilitate those goals during the meeting in order for the team to arrive at a coordinated and relevant program. Now, let's look at some of the cases wherein a patient needs the help of a rehabilitation team. So, when a patient arrives, to whom will you refer the patient? Number 1. This is for a dietitian. How about number 2? So, a doctor or a psychologist. Number 3, prosthetist. Number 4, this can be a nurse, to help the patient with a patient's positioning in the bed in the ICU. Or a physical therapist to help the patient with bed mobility. Number 5, we can refer the patient to a doctor or rehab doctor or a speech and language pathologist. I hope that you were able to answer that correctly. That will be the end of our lecture. And these are some of the reference that we used in today's lecture.